Suggestion on eye bag treatments and risk level if surgery is needed. I've had under eye bags since 10 years ago. It became worse in this couple of years due to my allergy to pollen and my bad sleeping position, laying on my belly. I have not tried any eye bag reduction treatments except some eye cream, and it is not helpful. Can someone give me suggestions on what procedure I should do based on my current situation and what the risk level is if I need surgery?
Thank you for your question. You've submitted two photos where you're smiling, but you describe in your history that you've had under eye bags for about 10 years, that the bags became considerably worse because of allergies and, in your opinion, sleeping on your face. And so you're asking about surgery and, of course, relative risk. So certainly I can help you understand what's going on with your under eye bags and give you some guidance about how to minimize the risk of any solution. To give you a little background, I'm a cosmetic oculofacial plastic surgeon. That means I specialized first in eye surgery before I had very selective training in a specialty called oculofacial or ophthalmic plastic and reconstructive surgery. It's a very narrow specialty after eye surgery training, and it's very it's surgery dedicated or dealing with diseases, conditions of the eyelids, the orbit of the bones around the eyes, the lacrimal system, the tear gland, the tear ducts. So eyelid surgery is something I've been doing a lot for over 20 years in practice in Manhattan and Long Island. So when it comes to under eye bags in a relatively young person, we have to first help you understand what they are. They're fat pockets. The fat pockets are due to prolapse of the fat that's around the eyes, and it's called lower eyelid fat prolapse. And this is why the under eye creams that you did mention in your question don't work, because the fat is deep and it's a volume, therefore a topical cream is not going to do anything. Now, over 20 years ago when I went into practice, I made it a personal mission to minimize risk with any kind of cosmetic surgery. You know, I always felt that an elective cosmetic surgical procedure is something that if there's risks you can avoid, then let's figure out a way to avoid it. I'm also board certified in general cosmetic surgery that includes facelifts, breast surgery, liposuction, tummy tucks, etc. So what I did over this time was evolve a system and a process of doing these procedures with the principles derived from what I did first, which was making eyelid surgery a safer and lower risk procedure. Now there are two types of risks that you have to be concerned about. One is the risk of the type of anesthesia. And when you look at where the complications of plastic surgery occur, a significant percentage are related to anesthesia-related issues. Now, of course, when you talk about anesthesia, it's not the anesthetic specifically or the gas necessarily, but it's the systemic impact of being under general anesthesia compounded by the type of surgery that's being done. So this doesn't necessarily apply to eyelid surgery, but there are procedures such as liposuction or tummy tucks where there's risks of other physical and medical complications which are compounded by general anesthesia. What we do is we do these surgeries under local anesthesia. That's like the local anesthetic you get if you were going to the dentist. And we also give a little sedation, and that reduces the anxiety. The key is to minimize pain, minimize anxiety. So we've found that in our practice, and with all the things we do, whether it's facelift, breast augmentation, liposuction, we are able to accomplish these procedures with minimal physical risk. The second risk, which is also very important, is the surgical associated risks. Now, this is a controversial topic, but frankly, as coming from the perspective of a super specialist, I also come from a perspective as a person as to how doctors select doctors for people in their family. So, although when a physician has a family member who needs medical care, they always find the best in terms of the most specialized, with the most experience, with a focus in a particular area. So I'm going to advise you in the same way. As an oculofacial plastic surgeon, I can say that the anatomy and the complexities of the eye area in terms of just the training, if in oculofacial plastic surgery far exceeds in volume and complexity in comparison to general plastic surgery and facial plastic surgery. The numbers speak for themselves when you look at logs of surgical cases. Now, of course, it also goes to what type of practice you have. And again, I would say that in minimizing risk, going to an oculofacial plastic surgeon is somebody who understands eyes and understands at a very complex level eyelid surgery. The risks are diminished. Doesn't mean that we're immune to complications. No surgeon is ever immune to complications. But managing those complications is something that, when it comes to the hierarchy of surgery, for example, in my practice, patients come from around the world for me to fix complications of eyelid surgery. This is over a 20-year period of doing this, and people knowing that I'm known for doing revision surgery. So I would say that the balance to help you make the right decision would be is find the experienced doctor who does a lot of lower eyelid surgery, comes from a specialty background, and do it under local anesthesia with light sedation. I think that, again, is my opinion, and is how I do my surgery in my practice. And we do our surgery in our own facilities in both our offices, which are certified by the Joint Commission, which is the same body that certifies hospitals and surgery centers. So safety is, of course, of the highest value and is critical for the successful outcome of any procedure. So, talking about risk, these are the way. This is my advice to you, and of course, meeting with doctors and feeling comfortable with who you are having performed the surgery for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.